is Anne, and together with my group mates Henry, Kiran, Manpreet, and Erica, we, the Group 9, would like to present a nursing theorist and her theory. Ida Jean Orlando, Theory of Nursing Process. Ida Jean Orlando is a first-generation Irish-American born in 1926 and married to Robert Pelletier in 1961. In 2006, she was honored with a Living Legends in Nursing Award by the Massachusetts chapter of the American Nurses Association. Orlando began her nursing education at the New York Medical College School of Nursing, earning her diploma in 1947. She earned a bachelor's degree in public health nursing in 1951 from St. John's University. Orlando continued her education at Columbia University Teachers College, receiving her master's degree in mental health consultation in 1954. She also held an array of jobs in the nursing field in areas including obstetrics, medicine, and emergency room nursing. Ida Jean Orlando became an associate professor at Yale School of Nursing and a director of graduate program in mental health psychiatric nursing. She worked as a research associate and principal investigator for a National Institute of Mental Health grant project. The project, entitled Integrations of Mental Health Concepts in a Basic Curriculum, called for Orlando to collect data from observing students' interaction with patients and members of educational and healthcare teams. She reported her findings in her first book, Dynamic Nurse-Patient Relationship, Function, Process, and Principles, published in 1961. The book established what became known as Orlando's nursing process theory. In 1972, Orlando published her second book, The Discipline and Teaching of Nursing Process, which redefined parts of her original theory. She then retired in 1992 and passed away in 2007. According to Melis, in 2007, Orlando was one of the early thinkers in nursing who proposed that patients have their own meanings and interpretations of situations, and therefore nurses must validate their inferences and analysis with patients before drawing conclusions. The theory of nursing process is based on a mutual nurse-patient relationship that acknowledges how the actions of one affect the other. Orlando stressed the importance of patient participation during nurse questioning, set in motion by the behavior of the patient. According to this theory, all patient behavior can be acquired or helped, both verbal and nonverbal, and it's up to the nurse to interpret the behavior and determine the needs of the patient. The theory of nursing process focuses on how to produce improvement in patients' behavior. The nursing process has 5 stages: the assessment, diagnosis, the planning, the interventions, and lastly, evaluation. Our groupmate Kiran will talk more about the nursing process theory.
Thank you, Anne. There are 5 major concepts of Ida Jean Orlando's theory. A major concept of function of professional nursing. The purpose of professional nursing is the establishing principle. It is the finding out and meeting the patient's urgent requirements for help. According to Orlando, nursing is responsive to person who suffer or anticipate a sense of dependence. The patient is a focal point of the nurse's function. The nurse needs to provide direct assistance to patient to avoid, mitigate lesion, or cure the client's sense of helplessness. The nursing process discipline theory makes the purpose of nursing to offer the assistance to patient to meet their needs. If the patient has an immediate need for help, the nurse realizes and meet that needs. The purpose of nursing has been attained. Presenting behavior. These deals with patients' problematic situations. The nurse uncovers the patient's instant need for help through verbal and non-verbal behavior. To carry out this, first of all, nurse acknowledges the situation as problematic. How the patient behaves is considered the stimulus for the nurse to respond to the situation. Third concept is immediate reaction. This is the internal response which a patient observes with his or her five senses. The reaction include the nurse insight, the thoughts about the perception, and the feelings aroused from the thoughts they can't control. The automatic reaction occurs almost instant sequences. The nurse's past experience, skill, and knowledge combined with the nurse's understanding of the instantaneous situations to produce the nurse's unique reaction in the nurse patient relationship. The fourth concept is nursing processor discipline. It deals with the search of the patient needs. Any observation shared and investigated with the patient is immediately valuable for determining and meeting his or her wants or ruling out he or she has no needs at that time. Supposing anything is not correct, appropriate, or helpful, but the nurse must check the validity by exploring it with the patient client. Regardless of the aspect of reaction the nurse uses, the patient is affected by that action. Therefore, the nurse initiates the process of exploration to ascertain how the patient is affected, what she says or does. Only in this way can she be clearly aware of how and whether her actions are helping the patient. If the nurse can't explore the client's reaction, it obviously causes ineffective communication between nurse and patient that stops. Last and fifth concept is improvement. It means the resolution to the patient's situation. In this step, nurse actions are not evaluated, but the outcome of his or her activities are assessed to determine whether nurse action help the patient and how patient needs are met. Moreover, it's observable in patient behavior, verbal and non-verbal. If the patient behavior has not been rehabilitated, the purpose of nursing has not been met, and the nurse continue with the process until there is an enhancement. And my group mate Erica will present more about Ida Jean Orlando's theory.
Thank you, Kiran. I will present about the fundamental ideas of Ida Jean Orlando's nursing process theory. There are several assumptions about Ida Jean Orlando's model or theory that support nurses' role in finding out and meet the needs of the patient through thorough assessment of the patient's behavior in response to the environment, the nurse, and the treatment. Ida Jean Orlando's model of nursing makes the following assumption. When patients cannot cope with their needs on their own, they become distressed by feelings of helplessness. In its professional character, nursing adds to the distress of the patient. Patients are unique and individual in how they respond. Nursing offers mothering and nursing analogous to an adult who mothers and nurtures a child. The practice of nursing deals with people, the environment, and health. The patient need help communicating their needs. They are uncomfortable and ambivalent about their dependency needs. People can be secretive or explicit about their needs, perception, thoughts, and feelings. The nurse patient situation is dynamic. Actions and reactions are influenced by both the nurse and the patient. People attach meanings to situation and actions that aren't apparent to others. Patients enter nursing care through medicine. The patient cannot state the nature and meaning of his or her distress without the nurse help for her first having established a helpful relationship with the patient. Any observation shared and observed with the patient is immediately helpful in ascertaining and meeting his or her need or finding out that he or she is not in need at that time. Nurses are concerned with the needs the patient is unable to meet on his or her own. The next one I'm going to talk about is how does this theory or philosophy relate to 21st century nursing practice. 21st century nursing practice is way different from the 20th century or way back during Nightingale's era. The evolution of nursing practice is no longer just about the care of the sick and patient focus as component of good practice, but rather because of the technology that made it possible to change the character and the content of work and change the work of the nurse and the place where he or she can work. The 21st century health system has been greatly influenced by the unpredictability of technology that changed the relationship of the nurse to the patient as well as their relationship to the service system. Nursing now has the obligation to change the following elements of nursing service within a more contemporary model of clinical care. Orlando's nursing theory or philosophy related to 21st century nursing practice in a way where it was where nurses can find out and meet the patient's immediate needs through nursing process, which are assessment, diagnosis, planning, implementation, and evaluation, which validate or give a clear definition of function of nursing in line with the advancement of the role of technology in changing the character of healthcare system, function, and service. The nursing process are especially useful, most especially in contemporary model or clinical care. It directs physician of what to incorporate, to do, and when to do it. It allows another medical team to rely on assessment to proceed to the diagnosing process where technology was incorporated for easier and faster access of result and information. But Orlando's theory supports nurses to have the framework or guidelines of their function as a nurse in setting where technology and other discipline are in work together. To apply this nursing theory, our group mates Henry and Manfred will talk more about our case scenario and the nursing process.
Thanks, Erica. For our case scenario, let's meet Mr. M. Mr. M, 62 years old, male, admitted to the medical ward 2 days ago with admitting diagnosis of pneumonia, receiving present IV fluids of normal saline, 1 liter at 125 cc per hour, and infusing well. During the rounds, the patient suddenly complained of difficulty of breathing and shortness of breath. Patient had a health history of cigarette smoking for 20 years. To help Mr. M, we will use the Ida Jean Orlando's theory. The first stage of the nursing process is the assessment. According to Orlando, assessment is the initial stage of the nursing process, which is a vital tool to assess the patient's holistic needs. The nurse uses a framework to obtain essential data, both subjective and objective, to formulate a solution for the patient's condition. For our patient scenario, we are going to assess for the subjective and objective data, health history, and verbalization if possible. For example, assessing for respiratory rate, rhythm, and depth, signs of distress associated with dyspnea, use of accessory muscles, and nutritional status. Taking vital signs and use of pulse oximetry to monitor oxygen saturation and obtain health history for contributing factors. Manfred, one of my group mates, will talk more about the nursing process.
Thanks, Henry. The next stage in the nursing process is diagnosis. This stage uses the nurse's clinical judgment about health problems. The diagnosis can then be confirmed using links to defining characteristics, related factors, and risk factors found in the patient's assessment. The planning or goal setting is the third stage of the nursing process. It occurs with participation from the nurse and the patient. The nurses act as patient advocates. In goal setting, the problem identified in the assessment stage are addressed. Goals are always the relief of the patient's needs.
The fourth stage is intervention. This is the stage of the nursing process in which the nurse will apply the formulated care plan to meet the goal of care for the patient.
The last stage of nursing process is evaluation. It focuses on the change in the patient's behavior. The evaluation consists of what was done well and what needs to be changed. The information gathered should be used to redirect the client goals until improvement is seen. For any action or intervention to be deliberative, nurses must evaluate its effectiveness.
Back to our case scenario with Mr. M. The subjective data are complaints of difficulty breathing and shortness of breath, and Mr. M verbalized, I have trouble breathing. The objective data are productive cough, dyspnea, restlessness, crackles on both lung fields upon auscultation, use of accessory muscle and nasal flaring. The vital signs revealed temperature 36.7, respiration 25 breaths per minute, pulse rate 104 beats per minute, BP is 120 over 80, oxygen saturation is 85% in room air.
Our nursing diagnosis with Mr. M case is ineffective breathing pattern related to existing medical condition as evidenced by difficulty of breathing and shortness of breath. Our client goals are by the end of the shift, the patient will be able to verbalize ease of breathing, show normal oxygen saturation, will define relief from cough, and will be able to breathe easily.
Our intervention are administer the safe oxygen therapy as ordered. Is it essential to maintain an adequate amount and continuous supply of oxygen in the body and prevent desaturation? Positioning the patient in high Fowler's position, this will help the patient to have a good lung expansion. Reassess vital signs including oxygen saturation. Reassess patient's skin color and temperature. Cyanosis is a sign of decreased hemoglobin level, and cold pale skin compensate for hypoxemia. Monitor patient mental status. Restlessness is an early sign of a decrease of oxygen in the brain. Put the side rails up for safety. Make sure patient is accompanied by family member or member of the healthcare team. Increase fluid intake unless contraindicated. Monitor arterial blood gas for the appropriate level. The increased pressure of carbon dioxide and decrease the partial pressure of oxygen are signs of respiratory failure. Encourage the patient to perform deep breathing exercises and relaxation techniques. These techniques promote increased oxygenation and prevents pulmonary complications. It also reduces pain and anxiety. Provide health teaching related to pneumonia, its risk factors, signs and symptoms, and precautions. Relay the results of the diagnostic test to the physician accordingly.
Client evaluation. After the end of the shift, the patient demonstrates improved airway patency as evidenced by adequate oxygenation by pulse oximeter and arterial blood gas values. The patient demonstrates feeling more comfortable and able to communicate his needs and maintains good hydration as evidenced by adequate intake and output. The patient shows no signs of confusion, restlessness, or agitation and identifies the hazards of cigarette smoking. The patient demonstrates deep breathing and coughing exercises and performs activities with less shortness of breath. That's the end of our presentation On behalf of Group 9, thank you for watching our presentation.